what could this have to do with prednisone? We've got cilantro and green lettuce. I wonder. So, prednisone, we know depletes tons of nutrients, but one of them I wasn't sure about is vitamin K. And I want to talk all about vitamin K today because in pharmacy school, we learned about a lot of vitamins, but some of them we focused on more than others. And vitamin K, we focused on a ton. And that's because it's vital for the understanding of one of the most toxic drugs, and that is warfarin or Coumadin. And if people who are taking that drug suddenly start eating lots of green leafy vegetables, it can actually mess them up and poison them, and they could bleed to death or have a stroke or something. That would be terrible. But what does that have to do with prednisone? What I found out is that vitamin K has two different kinds. We only learned about the one in pharmacy school, vitamin K1, but there's vitamin K2, and it is really important for bone health. And prednisone is the number one drug that depletes bones, causing bone loss. From the calcium to the vitamin D, prednisone causes more osteoporosis than any other drug. Hands down, no competition there. And all of its sister hormone, steroids just like it, like dexamethasone, hydrocortisone. So when I'm talking about vitamin K, I'm going to be focusing on vitamin K2 because vitamin K2, we've discovered, has to do with bones. Vitamin K1 was really important for clotting. We learned all about it, learned how vital it was to allow your body to stop bleeding. It's this amazing hormone that allows this whole cascade of things to happen so you don't die and bleed to death. But vitamin K2 looks a lot like it. It has this pretty ring structure, and then it has all this little chain at the end. And that is really important to help us have proper bone, not density, but bone quality. We've all learned that calcium and vitamin D can help with bone density, right? You've heard of bone density tests and getting your DEXA scan to make sure you don't have osteoporosis. But what we don't hear about as often is about bone quality. And I didn't hear about that. This was just a light bulb moment for me. Finding out that there's more to bone than just, it's not a rock. It's not dead. It's not just calcium and vitamin D just sitting there. It's living. It's actively changing every day. In fact, over 10 years, your body replaces your entire skeleton of bone. And so we need to make sure that all of the things, not just calcium and vitamin D, are proper in our bone. And another thing I learned was how vital collagen is. I didn't realize there was so much collagen holding the calcium, vitamin D, and all of the other minerals together. It's this, collagen is this protein structure that binds them together. And what helps the collagen work properly, one of the things is vitamin K2. So K2 helps with another protein in our bones, the second most common protein called Osteocalcin. And it is what helps drive the calcium into the bones. So it promotes the calcium accumulation in your bones. And calcium isn't just in your bones. Calcium's also floating around in your blood system. And when there's too much calcium in your blood, it can deposit in your blood vessels. And that is a big problem that can lead to heart attacks and strokes and all sorts of hardening of the artery. They test that by seeing how much calcium is in your arteries. Okay, so then the calcium in your arteries, we want to not be in your arteries, but to be in your bones, right? So what other prednisone side effects does calcium and vitamin K2 have to help with, specifically vitamin K2? So we talked about osteoporosis. That's the bone loss that can lead to breaks, fractures, shrunken spine. Next is osteonecrosis. Necrosis is death, bone death, especially of the hip and shoulder joints. The little ball on the top of the bone dies. Like, it dies. And so what we need to do is make sure that we prevent that. And they've actually done a study to show that in rats, we don't have any in human yet, but in rats, given a steroid called dexamethasone, that's a lot like prednisone, it stopped the osteonecrosis in those rats. So that's amazing, because I've heard from lots of people that osteonecrosis, or avascular necrosis is its other word, is one of the worst side effects of prednisone, because you have to get a hip replacement, even if you're 30. It's crazy. And so it can help with osteonecrosis. Another thing I learned is how vital the bone metabolism and system is for your immune system. I didn't realize how much of the bone had to do with your immune system, from the vitamin D to the vitamin K to helping your body create the proper cells that attack the bad things that we are wanting to attack, from bacteria to fungi to viruses, whatever those things are. Your bone helps create those cells. And then finally, metabolism. Metabolism means how we use things up in our body. And bone helps with the proper metabolism of other nutrients. So having proper vitamin K2 helps with all of those things that prednisone is interfering with. So what other medications like prednisone interfere with vitamin K2? The next one is antibiotics. And that's mostly because the antibiotics are killing the bugs in your gut, the microbes, those little microorganisms that are in your gut, your microbiome, that are taking your food, breaking it down, and they're making vitamin K2. And so when you take that antibiotic, it kills those good bacteria, and then you suddenly have less vitamin K2. So those can deplete K2. Which drugs can interact with vitamin K2? Those include the one I started with, was warfarin, which is also known as Coumadin, which is the rat poison that they give people who have clotting problems and want to prevent strokes and heart attacks and other problems with that whole clotting cascade. So it was warfarin. The next one is phenytoin or dilantin, and that's usually given to people who have seizure disorders. And then the next one is the cephalosporins, which is a type of antibiotic. And then finally, this is important to understand, that vitamin K2 is a fat-soluble vitamin. So if you're taking a drug that depletes the fat, like the weight loss drug Orlistat, which is called Xenical, or bile acid sequestrants, and you'd know if you're on those. Some people take them for cholesterol lowering. So if you're on any of those things, it's possible that they could be interacting with vitamin K2 because you're not able to absorb it as well. So how can we get more vitamin K2? I always recommend food first. So eating vitamins is the best way to do it as a whole food. So if you want to get vitamin K1, green leafy vegetables are the best. Parsley is the highest for K1. And then kale, spinach, Brussels sprouts, those are all great sources of K1. But K1 isn't what we really are hoping for. We're really hoping for K2. And K2 is a lot harder to get from your diet. The best source is called natto, and it's a fermented soy product that people in Japan, in their traditional diet, they eat. And what they found is that the more women, postmenopausal women, ate natto in Japan, the less likelihood they were to have hip fractures and need hip replacements. And they did a population study. The more they ate natto, the less hip replacements. The less they ate natto, the more hip replacements. So I've never eaten natto. I don't know how to get natto. If you know about it, please let us know in the comments. That would be helpful. All I know is it's a fermented soy product in Japan. And it's the very best source of vitamin K2. And I forgot to explain one more detail about vitamin K2. There are several different kinds of vitamin K2. And the scientific name for K2 is menaquinone. And it depends on how long that little chain is at the end of those two little rings. So if there's only 4 things, that's MK4. If there are 7 little chains at the end, it's MK7. And that's the one we want to focus on, is vitamin K2, MK7. That's the very highest quality version of vitamin K2. And why is that? Well, first of all, the longer the chain, the more fat soluble it is. And so that means it lasts in your blood longer. So it's more bioavailable, you're able to absorb it better, and it has a longer half-life. It takes longer for your body to break it down. That means it has more ability for your body to use it before it breaks it down in your liver and in your bones. So vitamin K2, MK7. And the MK7, like I said, is the one with the longer chain. It is kind of newer on the market. Scientists knew about it before, but they didn't realize the difference between the MK4 and the MK7. But now we found out how vital the MK7 is for bone health. And I've talked about a lot of those things before, but natto is the best source. And then second is the liver, beef liver or pork liver. Eggs have a little bit, and soft cheeses have a little bit. So those are some food sources you can go for. Ways to increase your absorption of it would be to add fat. So while we're not focusing on K1, a way to increase the absorption of K1 would be to add oil to your green leafy vegetables. So you could saute it in oil, or you could have an oil-based salad dressing. I think that might be one of the reasons we add salad dressing, is so that we can actually absorb these fat-soluble vitamins better. Another way is to eat more of those soft cheeses or egg yolks. And then finally, you can supplement. So supplementing vitamin K2, the MK7, and my little guy is here. Okay, shh. Okay, shh. So MK7, you can supplement. You can go on Amazon and buy it all alone as a standalone thing, and it can cost like $50 a bottle. And it's awesome. It's high quality. They're usually derived from soy, like the natto. There are a few derived from other sources like bacteria, but the most common is that soy-derived version. And then you can buy it as standalone. They also have it in combination with other bone-building things like magnesium, calcium, and vitamin D. And so you can buy like a bone strength one on Amazon, and those are great. For people on prednisone, though, I wanted to let you know that I've put it all together in one product. So it's not just vitamin K, MK7. It's that, and calcium, and magnesium, and not just any magnesium, but the best kind, magnesium glycinate. It's vitamin D, plus all the other nutrients that prednisone depletes. All of them. They're all here. It's called Nutranize.com. You can find it at Nutranize.com. You get the morning, 2 in the morning and 2 at bedtime, all for the price of one supplement. You can toss all your other supplements away because this has everything you need in it. And I personally designed it as a pharmacist. I'm Dr. Megan, the prednisone pharmacist. Using my clinical training, having actually encapsulated thousands of capsules in my career, and having had my doctoral of pharmacy training. So I put all of that together in combination with my experience personally taking prednisone for 9 months and suffering tons of side effects. I took all of that together with all of my research and created Nutranize Zone for you so that you can feel better while you're on prednisone, knowing that not only do you have all of these ingredients that help you feel better, but you're giving back those that are being depleted. You can find it at nutranize.com. And I'm Dr. Megan, your prednisone pharmacist.